Okay, thank you, everyone. Welcome to our sixth and final installment of our Webinar Wednesday series. We've already discussed so many topics on wellness and nutrition and helpful tips on how to stay healthy. Today's going to be another great topic. But before we get into the presentation, we want to go over a couple things. First, we wanted to thank our sponsor, which is the Rural Maryland Council um, Prosperity Fund. We're really happy to have been able to bring this webinar series to the public, and we're thankful for their support and their help in doing so. And we want to go over who ASAHEC is, what our mission is, and why we're doing these webinar series. It's because as an organization, we provide educational resources and support through community-based activities in order to recruit, retain, and train healthcare professionals on the Eastern Shore by way of collaborative and innovative partnerships. We want to do all we can to promote healthy communities and well-trained health workforce in underserved areas, which the Eastern Shore is. So we're really happy to have this series to be able to continue to do that and support our mission and vision. A couple of tips and things to keep in mind so we can all enjoy the webinar to the full. This is going to be a format where anyone can ask a question at any time, but we ask that if you're not asking a question that you could remain muted. Please turn your video on if possible. We'd love to see your face as we're all engaged in this discussion. And you can use the chat feature for questions or comments throughout. We will be monitoring that. As noted, we are recording this so it can be available for viewing at later sessions for others who were not able to attend live today. And we will also be offering some polls for pre and post knowledge questions, but everything's going to be anonymous, so you don't have to worry about that. And one of the most exciting parts of our webinar, our series that we're excited about is we're offering full prizes. So anyone who has attended through the entirety of the episode today is going to be eligible to win a prize. So we have a couple prizes. One is going to be a backpack, thanks to our guest today. She can explain a little bit more about that later. And we're also going to offer a first aid kit. So without further ado, I will introduce our guest who is visiting us from the University of Maryland Extension. Her name is Carrie Sorenson, and I'll have her tell you a little bit more about herself.
All right. Thank you so much for having me. I'm really looking forward to, getting to share some information with you all today. So like she said, my name is Carrie Sorenson. I work for University of Maryland Extension. And my position is really focused on providing financial information, financial literacy to everyone. Maybe one of the lesser known services of University of Maryland Extension is that we have health and finance related programming available through our extension offices, and we're located in every county in Maryland. I work out of the Carroll County office, but we have folks on the Eastern Shore, and we're really just here as a resource for the community to be able to provide information that folks need. And finances is definitely one of those things. So in the sort of area of finances, one of the things that we talk about fairly often is health insurance literacy, because I probably don't need to tell most people that health insurance can be really confusing. We started this program when the Affordable Care Act was passed back in 2014. And one of the first things we did was just reach out and ask people, how are you feeling about your insurance? Do you feel like it's something that you can use when you need to? And we'll talk about this a little more as we go along. But in general, people said, no, I'm confused. I don't know what to do with it. I don't understand how it works. And that's always concerning for folks who work in this area, because we know that when people can take advantage of their health insurance, get the care that's included within their health insurance, that it's better for them both financially and for their health. And so we have these sort of like two really important things tied to our health insurance and being able to understand it and use it effectively. And so that's where this program came from, is just this focus on helping people feel a little less confused, a little less stressed, a little more confident and capable of doing what they need to with their health insurance. And that's really what we're going to focus on today. This program we call Smart Actions. So we are just going to review some simple things that you can do to get the most out of your health insurance. We'll go through 7 smart actions. We'll talk about some really important things to understand and what you can do with that information. And hopefully by the end, we'll have a better, understanding. We'll feel more confident about using our health insurance. Before we do that, we are going to do a little knowledge poll to see what you guys know before we get started today. So I am going to stop sharing the presentation, and then you should be able to see the questions. You don't have to do it, but we really appreciate if you can answer the questions. It helps us get sort of a better idea of what folks learn by participating in webinars and things like this.
So our first question is, how confident are you when understanding your health insurance coverage benefits? Okay, thank you. It looks like everyone has responded. So it looks like it's split completely. Some are confident, some are moderately confident, some are slightly confident, and one not at all.
That is so funny. Everyone feels different about it, which is, I think, honestly, a pretty good, that's a pretty good spread for what generally people feel like when it comes to this topic. All right. So going in knowing that, I think this will be good because I think it'll mean we have some folks who can maybe share experiences of their own. We have some folks who can maybe ask some questions or tell us what they're not as sure about. So I think that'll be great. All right, just double checking. Do we have any more poll questions we need to do? Okay, perfect. So then we will get going. Okay. So like I said, the plan for today is to make sure that we understand how to use health insurance, that we know how to manage healthcare expenses. We'll talk about some tools that you can use in the event that you have an issue or some sort of problem that you need to solve with your health insurance. And when we do all of that, the way that we've sort of thought about it is that if you can do all of those things, then you're someone who can use your health insurance in a smart way. And we like the smart user idea because there's no one perfect thing to do with your health insurance. It's not like there's this sort of set of rules you have to follow. And if you check all the boxes, then you're doing all the right things. Everyone's health is different. Everyone's life is different. Everyone's health insurance is a little bit different. So we know that everyone has a different sort of approach that they're probably going to end up taking. But if there are like some key things that we know that everyone can do, and if they do them, it just makes it that much easier to get what you need out of your health insurance. So when we talk about health insurance, we talked about this a little bit, but it's so important because it helps us stay healthy, be able to go to school, be able to go to work and do the things that we need to do. It helps us both prevent, and then also if we get to a stage where we do have some sort of chronic illness, manage a chronic illness. So being able to, go to doctor's appointments for a checkup, have them check our blood pressure, have them do blood work and see where we are with different things can help catch something that might be going wrong early, or be able to treat something that might be going on and we're not even always aware of it. So being able to have our health insurance and use it for those things is really important. We also know that the more people take advantage of preventive services, so those are things like vaccinations, blood pressure screenings, cancer screenings, all those kinds of things, all those things where we proactively go out and look for signs of something before it happens. They help keep us healthy. They help make it less expensive to treat things because we're catching them earlier in the process. So again, that sort of dual, we've got the money side of things and the health side of things. And when we can take advantage of the preventive care, we can kind of have the best of both worlds, where we're managing our health and our finances. There are also really important things about how to use our health insurance to save money. We'll get into this and talk a little bit about it, but just in terms of some of the basic decisions we make about who we decide to see, what doctors we go to, what services we get, making those decisions can affect how much we end up paying for them. And so we need to know how our health insurance plan works so that when we go and get those services, we're hopefully paying as little as possible to get them. That's the goal. And then avoid costly problems. And I think that that is something that I hope a lot of us are, trying to do, is manage our health, and really, avoid hopefully those big things that can kind of go awry along the way. Okay. So, have you ever felt like this? Have you ever felt like someone is just sort of throwing words at you, one right after the other? Maybe you're at the doctor's office and you're filling out a form and they're saying, do you have an HMO or a PPO? Who's your PCP? Do you have a referral? What is your copay? Can I see your insurance card? All these different things. And so it starts to feel like these terms are just sort of flying around and we're like, whoa, what is going on? That is one of the key things that we learned when we were surveying people about their experiences with health insurance, was that one of the things that made it the most challenging to understand health insurance and know what to do was the terms. There are things like I talked about, HMO and PPO, these different things that they're really only terms we use when we talk about health insurance. And so if it's not something we're hearing very often, it makes complete sense that we would hear it and think like, oh, I'm not 100% sure if I know what that is talking about. So one of the things that we can start off with is just having a really solid foundation of knowing our health insurance terms and knowing sort of what they mean, and asking questions if a term comes up that we don't know what it means. I think sometimes it can be really uncomfortable to say, hey, I don't know what you're talking about. But when it comes to our health and our finances, I just want to encourage you that this is something that's confusing for so many people, and you should not feel bad at all telling someone, I'm confused. I need you to explain this to me one more time. And that is 100% something that I recommend, something I do now more often since I've started teaching this program. If you notice me looking over here, I have more than one computer screen and I'm just getting a link for you. So one of the things that we have is a document to help people understand all of these different health insurance terms. And I'm sending a link to that in the chat. Oh, that's going to be just to the main page. Let me do the overall. Okay, so copy link. Okay, so this document is our important words to know document. And essentially what we did was go in and look at what are the most important terms that come up when we talk about health insurance. And then we found the definitions for those terms and learned that most of the definitions you can find either use the term in the definition or are just as confusing as the initial term itself. So what we did then was go through and rewrite the definitions to be a little bit easier to understand. So if you're looking for a starting place, we think this is a really great one. You can go through it and it has, the different types of plans and how they work. It has terms about the costs like copay, coinsurance, and deductible. And so you can go through and understand hopefully a little bit better some of the terms that we'll talk about as we go through our presentation today. Okay, so like I mentioned, this presentation is focused on smart actions. So we're going to go through smart actions that you can take for your health insurance. So our first one is knowing what your policy covers. And I know that seems like it's kind of like, okay, well, don't all health insurances cover the same things? And broadly, yes, there are kind of a broad set of things that they all have to cover, but it's when we get into the details that things can get a little bit different and weird going from plan to plan. Okay, it's really important because we need to know what is covered in terms of, sometimes we call them services, sometimes we call them benefits, but essentially it means what can I go to the doctor for and then my health insurance will pay for. Sometimes there's a little bit of confusion because people might think, oh, if my insurance doesn't cover it, then I can't get that service at all. If your doctor prescribes something, then you can have that test, medication, whatever it is. When we talk about a covered service, we just mean, is your health insurance going to pay for it? And if so, how much are they going to, pay or cover? And so that's what we're talking about here, is knowing what's included in the plan and what they're going to pay for. Because I think a lot of us, if it's not included in the plan, it's not always an option. It's really difficult, I think, to pay out of pocket. The other thing that we want to know, how do the plan costs work? So sometimes things are covered in the plan and the health insurance maybe pays for 100%. So they will pay for the whole cost of that thing. But sometimes they set different amounts. And so you might be responsible for paying for a part of it, and the health insurance is going to be responsible for paying for a part of it. And so we want to understand how we call that cost sharing. How does the cost sharing work in the plan? What am I going to get charged for, and what are they going to pay for? We also want to make sure we know how to find in-network doctors and facilities. We will talk about this much more in depth. Using in-network doctors and facilities is one of our smart actions. So we'll talk about this a bit more. But it's important to know that that's sort of within how the policy is set up. It defines what it means to be in-network and out-of-network. It'll also tell you how to dispute a billing error. And again, we'll talk about that a little bit more. So part of the reason that it can sort of feel like, well, isn't all health insurance the same, is because we have what's called the essential health benefits. When the Affordable Care Act was passed, we said, okay, in order to call yourself health insurance, you have to cover certain things. And it's what's listed here. Before the Affordable Care Act was passed, you might find health insurance that really only covered, something crazy happening and you're being hospitalized. But it might not have covered, maternity care, or behavioral health, like addiction services or mental health treatment. And that was one of the things they did to sort of make it less expensive, was they'd say, well, we're not going to cover some of these other things. But what would happen would be people weren't always aware of what their plan covered and didn't. And so they'd go to the emergency room or to the doctor, get certain care, and then get a bill for it later. And that bill could sometimes be very high. And so as our government said, okay, we can't have all these different things going on. Health insurance, if we're calling it health insurance, it's got to cover certain things. So preventive care, testing, being hospitalized, prescription drugs, outpatient care, maternity care, pediatric, mental and behavioral health, and emergency room services. Now, that does not mean that all of those things will be free, or that everything that could possibly fall into one of those categories will be covered. But it means that all health insurance has some coverage within these things. And we'll talk a little bit more about how to understand that. Okay, so if we are trying to understand what our policy covers, the best thing to do is review the evidence of coverage. The evidence of coverage is a somewhat giant document that you get when you sign up for health insurance. And it's a legal agreement between you and the health insurance company. And it details exactly who is responsible for what. And essentially what it says is, if you, as the person covered by health insurance, pay your monthly premium, we, as the health insurance company, agree to do the following things. And so it spelled out exactly what is going to be covered, okay? The evidence of coverage is usually, sometimes it's shared with you electronically, sometimes it's sent to you in the mail. If you are not sure where yours is, or if you ever received it, you can reach out to your health insurance company and ask for another copy, and they should have no problem sending it to you. Once you get it, it usually has categories where you can go through sort of those different big things that I mentioned. So you might flip to the preventive service section, and it's going to show you cancer, like breast cancer screening available to women over this age. So it's going to tell you the conditions under which you can access certain services. And then it'll also tell you how much it's going to cost. If you're familiar with using the search keys, so like a control plus F will search a document for something. So if you're looking for something in particular, you might want to get the electronic version and use that search function to look for the particular thing you're wanting to see information about. They can sometimes be, this document might be like 100 pages. So the search feature can help you sort of jump to that information more quickly. Okay, our next smart action is having proof of insurance at all times. The Proof of insurance is what tells the provider what kind of health insurance you have. It also tells you how much certain things cost. We call those co-payments. So that's how much you pay when you go to the doctor for those different things. It will usually also have a phone number that you can call and have questions answered. And so what is the proof of insurance? Where do we find all this information? It is on our health insurance card. Again, if you've lost it, if you're not sure where it is, you can request a second copy be sent to you, and they should either be able to mail it to you or get you an electronic version. Once you get the card, this is sort of an example of what they look like, but it'll have your name, your member information. If you look at where it has the number 5, you can see the different copays listed for primary care, for specialists, for emergency room. So it gives us an idea of what those costs are going to be. It has the prescription copays on this one as well. Sometimes there are 2 different plans. So you might have a medical card and a prescription card. Sometimes they're together. So you might have more than one card. Number 6, we can see the member service number. Sometimes it will also have a 24-hour nurse hotline as well. So sometimes you can call and say, I'm experiencing this, do you recommend that I go to the emergency room, urgent care? So you can call and chat with someone if something's happening and you're not quite sure what to do. I know I've used that a number of times. I used it when I wasn't sure if I needed to go to the doctor, and it turned out I had appendicitis. And I'm very thankful to the nurse who recommended that I go to urgent care, because it sounded like there could be something wrong. She was lovely, and I very much appreciate her advice. So being able to have someone that you can talk to and say, I'm not feeling the best. This is what's going on. Do you think I should wait? Do you think I should go to the doctor? That can be really helpful. So there might be that sort of medical advice line, and then the member services, which is where you'd ask questions about billing, what's covered under your plan, those kinds of things. So you might have more than one phone number listed. Okay. Our next smart action is to use in-network doctors and healthcare providers. So the most important thing with this is that your health insurance will typically have contracts with different doctors or doctors' offices. And basically what they do is they sit down and talk, and they say, okay, if someone comes in and they need an X-ray, how much does that cost? And the doctor's office says, well, we charge this much. And the health insurance company says, well, we're willing to pay this much. And so they kind of go back and forth. And then they agree, okay, there's a number we're both happy with. And then they kind of set that amount. And so the doctor's office knows when someone comes in with this type of health insurance, they're going to receive a certain amount of money for the different services. And so they kind of agree on everything ahead of time. And we call that being in network. So for some plans, you can only see in-network providers unless it's an emergency. So if you have, it's usually like an HMO or a POS. So certain types of health insurance plans will say, we only cover in-network care. Other plans will say, we cover in-network at a higher percentage. So the insurance company will pay more if you stay in network. And if you choose to go out of network, you have to pay more out of pocket. So no matter what kind of health insurance you have, it saves you money to stay in network. If you have a plan that only covers in-network providers, it saves you a lot of money to stay in network. If you have a plan that has coverage for both, then it probably saves you a good amount of money still to stay with an in-network provider. So it's very important. Usually you can find this information through the insurance company, but you can also reach out to a doctor's office. So if you're calling the insurance company, you would say, can you send me a list of in-network providers? And then usually they're going to ask for the reason. So maybe you need to see a specialist because you broke a bone, or maybe you just need to see a primary care doctor or regular doctor. And so they're going to ask, okay, what's the reason? And then send you a list of their in-network providers. I will say, they don't always check to make sure that everyone on their list is taking new patients. So sometimes you have to call around on that list to actually find somewhere you can go. Some people prefer to start with the doctor's office. So they find a place that they're comfortable and they want to go. And then they reach out and say, are you an in-network provider for this particular insurance plan? So you can do it either way. But the most important thing is just checking with the health insurance company or with the doctor's office to make sure that whoever you're seeing, unless it's an emergency, is an in-network provider. Okay, so our next smart action is to use preventive services. And we've talked about this a little bit, but it helps keep you healthy. The other thing with this is that it doesn't cost you anything extra. So the way that the law was written is so that the preventive services sort of have this extra incentive. So preventive services are no out-of-pocket cost. So if I go to the doctor's office for my regular checkup, they order blood work just to, check my numbers and see what's going on. All of those regular checkup things are usually covered and we don't have to pay anything for them. They're just included in the health insurance plan. So I have people ask me all the time, if I don't go to the doctor very often, why would I sign up for health insurance? I just have to pay the monthly premium and I don't really get anything out of it. But what you get out of your monthly premium is all of the preventive services that keep you healthy. So ideally, we want folks to take advantage of those things because they're just so effective at helping people stay healthy. So that's really the things that are just like included. They're baked into having health insurance at all. You can go get a checkup and make sure that things are going the way they're supposed to. Okay, so where can you find the information about the preventive services and what's covered? Typically, that's going to be with your insurance company. Your doctor's office will probably let you know, hey, you're 40 at this point, we typically do this test, or you're 50, maybe it's 55, I can't remember what the cutoff is, but that's when you get to have your colonoscopy. And so they'll kind of let you know, hey, it's time for you to start thinking about some of these things. And if you want to double check, you can reach out to your insurance company and make sure that it's going to be covered. You can also go to healthcare.gov and they have a list of common preventive health things and the age that we typically recommend that they happen. All right, so our next smart action, and I think we only have one or two more after this, is to track healthcare expenses, which is maybe not the most exciting thing ever, but it's really important to make sure that you're being billed correctly. So when we looked into this, somewhere between 30% and 80%, which is a really broad range, but somewhere between 30% and 80% of all medical bills have an error. And so even if we're looking at the low side of that, that means that a pretty high percentage of medical bills have some sort of mistake in them. And what will happen a lot of the time is people get the bill and they just think well, the doctor's office knows what they're doing. The health insurance company knows what they're doing. This must be how much I have to pay. But we want to be paying attention. So if we go for preventive care and we get a crazy bill for it, we want to double check, was something coded incorrectly? I went to a doctor not that long ago and they just entered everything twice. It's clearly a mistake. And so we don't want to pay for things that are a mistake. But it can be really difficult to have the confidence to say, I know that this is wrong and I'm not going to pay it and get it fixed. The other thing too, and this seems a little crazy, is that we do have medical identity theft. So sometimes people will steal people's identifying information and use it to get medical care. So if you're getting something in the mail, or if you contact your health insurance company and they say, oh, you've already reached your deductible, and you're like, wait a second, I haven't been to the doctor this year. So if you're seeing things that you're not familiar with, then that might be an indication that someone's using your information that is not you. So again, we just want to be paying attention to those things to make sure that is not happening. You also want to have proof of services that you've received just in case something gets lost along the way, particularly if it's something that you might need to have a record of for some reason. Vaccinations are a good example of that. Sometimes you have to have proof for travel or for different sorts of reasons. So having proof of some of those things can be helpful just to sort of keep that information for yourself. The other reason that we recommend it is because you can use 1 year's health expenses to sort of estimate what your expenses might be the next year. So if you pull all of that information together, it gives you a pretty good idea of what your spending is like, so you can plan for that in the future. Okay, so usually you're going to find this information on the billing documents that your health insurance company sends you. So usually you'll get an explanation of benefits, an EOB that they send you after you receive any sort of medical care. And it's going to explain what they billed for, how much the insurance company paid, what, if anything, you still need to pay, and you can keep records of things that way. Sometimes it'll also be online. So if you're not getting documents like this in the mail, I've been working with a lot of folks recently who have like accidentally signed up for paperless. So you might have to either call the insurance company or see if you have an online account with them and see if those paperwork things and documents are going somewhere else. It's also a good idea to keep track of those over-the-counter healthcare spending things, allergy medicine, other, devices or things that we might need. There are certain accounts you can use. We won't get into those too much today, but flexible spending accounts and health savings accounts, particularly if you're using those, you'll want to keep track of any over-the-counter medications that you're spending things on. So you might just use like your bank statements or your checkbook or something along those lines to keep track of those. Okay, and then hopefully, ideally, we have somewhere to put all of those things. If you have a place in your computer to store them, that's great. If you have, a old-fashioned filing system somewhere at home where you keep those kinds of things, you can keep them there too. And they're probably only things you need to keep for maybe 2 or 3 years, and then we can kind of get rid of those and move on to the future. Okay, so once you have all of that information, you can sort of use it to estimate how much you might spend in the future. And the idea is that then you can sort of set aside or set up a savings account so that you can pay for out-of-pocket costs and be able to have money set aside for healthcare services that you might need in the future. One of the things we know from research is that people will sometimes avoid going to the doctor if they're not sure how much it's going to cost, or if they're not sure that they have the money to pay for it. And so if you have a savings account that's specifically for your healthcare expenses, that can be a really helpful way to make sure that you're not having that anxiety and you feel like there's money available if you need it to take care of those health-related costs. And then hopefully that encourages us to get healthy and stay healthy. Okay, so we talked about this, but we have the explanation of benefits and medical receipts, credit card documents, and things like that, where we can keep track of all of that information. And then we also have a tool that you can use that's the Understanding and Estimating Healthcare Expenses tool. And it'll actually walk you through this process step by step. It'll have you go through and sort of figure out, okay, last year, how much did I spend in these different areas? And how much will I potentially need for next year? So I'll add that link in the chat. And the one that I'm sending is a PDF that will do all the math for you. So if you do it on the computer, you can type in the information and then it will do the calculations so you don't have to. But if you go to our website, which was that first link I shared, we also have a printable version if you prefer doing it that way. Okay, so that is that. All right, and this should be our last smart action, using tools to solve a problem. So we talked about, health insurance. Unfortunately, both the health insurance companies and the doctor's offices make mistakes from time to time. And so we want to be able to solve these issues, these billing problems as they come up. We want to make sure we understand the process of actually how to, what do you do when you need to tell someone, hey, I think that you might have done this wrong. You want to make sure that your insurance company pays for the things it's supposed to pay for. We know that sometimes health insurance companies deny things that maybe actually should be covered. And so reasonable people can disagree sometimes about whether or not something falls within the policy. So you always have the right to ask for it to be looked at again, to see if it actually should have been covered. In emergency situations, you can, so we have different guidelines for how quickly your health insurance company has to respond when it's an emergency. But those guidelines are still, they have like 72 hours to get back to you. And in my experience, very few things are emergencies that can also wait 72 hours. So A lot of the time, unfortunately, we're dealing with this after the fact. But if you have one of those very unique emergencies where you can reach out ahead of time, if you know how their process works, then sometimes you can get responses more quickly. Okay, so the evidence of coverage is going to have the information about what we call it a dispute or appeal, what their dispute or appeal process is like. Usually it's just like a phone number that you call, or sometimes people will actually do it like in a written format. But how do you let the insurance company know that you're disagreeing with them and you'd like them to look at it again? That'll be in your evidence of coverage. Medical bills will usually also have a number that you can call if there's an issue or if you have a question. I will say one of the things that I have learned and noticed recently is that it used to be that there was just the doctor's office and the health insurance company. And sometimes they would not have the same information. And so we'd have issues there. There is also now like third-party billing companies that are doing the billing on behalf of the healthcare provider. So sometimes the healthcare provider themselves can't fix the bill. Sometimes you have to reach out to the company that's doing the billing for the doctor's office. So just keep that in mind, that there might be sort of an extra person involved there. Sometimes there's a billing expert or person at the doctor's office that you can go to in person if you have questions. If you get your health insurance through your employer, you might also be able to reach out to human resources and ask them to help you with any issues that come up. And the health insurance company should be able to assist you as well. Sometimes they take a little time to get back, but they do have resources. They should be able to help you solve a problem if it's something on their end. If you signed up through the marketplace, there are also navigators and assisters who can sometimes help you. Although a lot of the time, once they have sort of helped you sign up for the plan, they'll let you know you kind of got to go to the health insurance company for that. You can also always reach out to your local extension agent. So I'm here, Carrie. I'll share my contact information at the end. I'm located in Westminster and I cover the Baltimore County and Harford County areas as well. But we also have agents on the shore. You can always reach out to one of your extension folks if you have a question. They might just eventually connect you with me, even if you aren't in the Westminster area. But we do our best to help people find the resources that they need and point them in the right direction. Okay, so really quickly, we're just going to review the actions that we have. I'm going to go through this because it's a little small to read. But because we are a smart user, we will review the evidence of coverage. So make sure you understand what your health insurance plan covers. Have your health insurance card with you at all times. A paper copy is great, but an electronic copy works too. Although the doctor's office usually likes a paper copy because they then make a copy of it. Use preventive services to get and stay healthy. Choose in-network doctors and facilities. Plan for healthcare costs, track healthcare related expenses, and use tools to solve a problem. And so hopefully by being able to do all of those things, you can feel comfortable and confident that you know how your health insurance works and you can use it when you need to get the care that you need. All right, there are some resources that are listed here. The first one is the link that I already shared. I will also get the healthcare.gov link and share it in the chat. But these are great places that you can go if you want some more information. I have also thrown a lot at you today. So if that's something that you do maybe later, just keep them in mind that they're good resources to have. Okay, and with that, that is everything I have for you all today. We'll have some other follow-up things. We'll talk about prizes, but if you have any questions about the health insurance stuff, please put those in the chat and I'm happy to answer any questions that you all have.
Thank you so much, Carrie. That was really, really nice. A lot of good tips. So before we kind of wrap up, we have a post knowledge poll. If we could launch that. So hopefully we learned a little bit with all that she gave us. So it asks, how confident are you in understanding your health insurance cover coverage and benefits now after all the tips that she gave us? And then how likely are you to use your preventative services? We'll take a couple minutes for everyone to answer those.
And thank you guys. I appreciate everyone taking time out of their day to join us for this. When I started teaching some of the health insurance information, it was one of those like, I don't know, like I didn't know a ton about it, and it's been so helpful. So I'm always excited when people are willing to take time out of their busy day to learn a little bit more about it.
I think we're waiting on one person so we can finish this poll. All right, I'm just going to go ahead and end it. But yeah, thank you so much. It looks like we had some success in learning quite a bit. So thank you again, Carrie. Your wealth of knowledge and all of those resources from all your time at University of Maryland Extension has really, really been helpful, helping us navigate our health insurance coverage and benefits, and knowing those resources, even, the information that we can find on what we already have on our cards and all that. That was really helpful. Thank you so much.
Yeah.
So with everyone that's stuck around till the end now, oh, this is just a little shout out to some of the other things we're doing as Eastern Shore AHEC. We have a preventative type 2, preventing type 2 diabetes program that we're hosting that's already started this month. So we're really, really happy that we have all of this going on in the community, different classes to help people learn how to continue to stay healthy and prevent um, chronic illness. So we thank you for your time today. And that's just a little shout out to another program that we have. But without further ado, since that's the end, we have prizes. We have prizes. So I'm going to share my wheel. We have a few people that are eligible. So I have a little spinny wheel. Let me see. I'm sorry. Thanks, Carrie. If I can share, and everyone see the spinning wheel. Okay, great. I have added our participants in here. So let's spin first for the backpack. It's going to be from the University of Maryland Extension, thanks to Carrie. So let's see who our winner is for that. It's Jennifer. Yay. All right. And then we have a first aid kit. So we're going to purchase that on Amazon and have that shipped directly to our next participant who's eligible. So let's see. It's Pam. See, aren't you glad that you got to join us, Pam? So thank you so much. We're going to, Pam, if you could send us in an email your contact information and a good address to send that, we can ship that out to you. But again, thank you everyone for joining today. So we learned a little bit about health insurance coverage and just navigating it more. So we thank you so much, Carrie, for your time, and everyone for taking your lunch break out to learn a little bit more and hopefully stay healthy and happy and fit through the rest of this calendar year. So thank you so much, everyone, for attending our webinar.